Good evening, everyone. Hello. It's really nice to be here with you all for what is our 6th virtual town hall during these weeks of coronavirus here in Maine and across this country. I know our challenges continue to mount in front of us, whether it's regarding healthcare or how our children are learning, whether it's worry for safety of our loved ones and being apart from people, or whether it is worry about where our next paycheck is going to come from, or whether our small business will be able to survive this crisis and reopen. And so I want to just start this evening the way we always do, by reminding all of us and committing all of us to this idea that we are in this together and that not a single one of us has to be alone in this. If you feel like you are, if you are struggling to find and connect to the resources that you need, please reach out to us and we can help you do that. So before we go any further, I do want to acknowledge on this beautiful but windy April day that today is the 50th anniversary of Earth Day. And although we're on tonight to talk about healthcare and really focus on what we can be doing, I thought it was important to take a moment as we think about what we can do with our future and how to protect ourselves and our children and our grandchildren, to acknowledge that. So tonight we have a really special guest with us, and I'm excited to introduce him to you. His name is Dr. Ben Hagopian, and Dr. Ben, as we call him, is a practicing family physician in Portland. Now, he has continued his practice and treated patients with COVID-19 and during this time of COVID-19, but he has done that at a real price, beyond the obvious of putting himself on the front line. And because he is putting himself on the front line as a healthcare professional, he made the difficult decision to separate himself from his wife and his young son, and his wife, who is in fact expecting right now. So we want to really have the chance to hear from him why and how he made that decision, and what it is like as a physician on the front lines of this pandemic right now, what physicians and other healthcare professionals need, how we can support them here in Maine, but also what the federal government can be doing to make sure that they stay safe and that they have the tools that they need to fight this virus and to overcome it together. Before I turn this over to Dr. Ben, I want to just briefly talk about some of the ways in which we have been trying to lift the voice of Mainers in this conversation. Now, as we all know, the federal government has not shown the leadership that we need to date in terms of making sure that personal protective equipment is available for doctors and nurses and first responders, but also making sure that hospitals across Maine and across the country have what they need to face the financial crisis that they're in. One of the things that we want to talk about a little bit tonight is the plight, especially of rural hospitals. This is something that is happening here in Maine, and it's something that we're seeing happening across the country. Already, even before the time of coronavirus, the struggle for rural hospitals was very real. But now, when we have elective procedures going away, their struggles are even more severe. And that is something that we definitely need help from the federal government in dealing with. So to date, we know the response from the feds has been disorganized. It's been insufficient. We did see a package passed by the Senate yesterday, headed, I believe, to the United States House of Representatives tomorrow, that focuses a little bit more on some of the things that we desperately need to overcome this, including testing. And I look forward to Dr. Ben's conversation tonight about what testing should look like and what it means for all of us. In the meantime, I'm going to stop talking to you all at this moment and turn the conversation over to Dr. Ben. Dr. Ben, welcome, and thank you so much for joining us.
Thank you so much, Sarah, for that warm welcome. So I'm Dr. Ben Hagopian. I have a medical degree and public health degree from Case Western. I trained in family medicine at Maine Medical Center, and I've been practicing in Maine since 2011. I practiced for 3 years in Oxford County doing rural primary care, and I currently I'm a direct primary care doctor in Portland at Maine Integrated Family Care, and I also practice urgent care in Cumberland County as well. I've been taking care of a number of COVID patients. It's been a very, very challenging time for us on the front lines, but also for patients, as Sarah mentioned, not being able to get their elective procedures that they're used to getting. For us, it usually means more time to prepare for each patient, gowning, gloving, masking, face shielding. That along with the time in counseling, most patients are really just scared. They want to know, do they have COVID? How do they get tested? What should they do? And walking them through what does it mean for them? What does it mean for their families who may be living with them? If they have somebody elderly or somebody with a chronic medical condition at their home, and what does it also mean for their work? Do they have to stay out of work? Will workman's comp compensate them? And what does it mean for the employer when they lose an employee for days or even weeks at a time? Fortunately, I do think the testing capacity has improved lately. It wasn't so great in the beginning, but it is leading us to kind of, fly as we can. And, I'm currently treating anybody pretty much who has any respiratory symptoms or symptoms suggestive of COVID as though they do, because we don't have the capacity that we need to take care of this virus.
Ben, thank you so much for giving us a little peek into what things look like here in Maine from the perspective of a physician. I was wondering, and I hope you don't mind me asking such a personal question, but I know you and your wife have been pretty open about the decision that you made to continue practicing with a young family at home. I understand your son actually is going to be turning 3 on Monday, and your wife is pregnant with your second child, but you made this difficult decision 5 or 6 weeks ago to live apart from them in order, I think, to keep them safe. Could you just share a little bit with us all about your thought process and hers in that decision, how it's going?
Sure, absolutely. Yeah, we have been very public about it. I will say we made this decision knowing that COVID would be coming to Maine shortly. So we hadn't talked about it when it was just in China, but when we knew it was going to be coming to Maine, we started having these conversations about what's the best way for me to continue to work and take care of the people of Maine, but also to protect our family. And we didn't have really good information or studies or data on how dangerous this virus really is. And so I think for us, it was, let's operate from an extreme area of precaution, perspective of precaution, rather than crossing our fingers, hoping it goes well and hoping I don't bring it home. So it was a very difficult decision, but it was a way that my wife, my pregnant wife, and my son, and her parents, who were also local, they would not be exposed at all. So that was the thinking that went into it. It was a pretty quick decision. It felt a little crazy in the beginning just because we didn't know, and other physician friends and medical friends that we have weren't doing that, and we were kind of getting some weird looks. But we're glad we made the decision. We made the pact to kind of reassess this decision pretty much every week, because again, we didn't know how dangerous or not it was. But the farther we went into this process, the happier we were with our initial decision.
Yeah, absolutely. And, as you talk, Ben, I realized that the very first thing I should have said is not thank you for being here talking with us tonight, but thank you for continuing to do your job as a physician and to treat all the patients that you do, but especially those with COVID-19 at what is really a personal sacrifice for you and for your wife and son as well. So on that note, I'm hoping you could share a little bit more with us and help us understand from a physician's perspective what personal protective equipment is, literally, and what it means to you and your fellow colleagues in order to be able to do your job.
Sure. So personal protective equipment, most people have probably seen it in the media as PPE, is anything that is going to help prevent a person from getting sick. So could be gloves, it could be a gown, could be masks, face shields, sanitary wipes, all of those things. And we have seen through stories across the country, there is a significant lack of it, and there was a lack of proactivity in producing enough for something like the outbreak we have now. Can you repeat the other part of your question?
Well, that was really it. I wanted to help people understand, in case they didn't, exactly what PPE is and what it means to you. And I think you really described that. It's essentially the way that you are able to do your job, and while protecting yourself, yes, but also stopping the spread of the virus unnecessarily.
Correct. So so PPE is important at the most basic level to prevent the spread of the virus from a COVID positive patient to a COVID negative patient by, perhaps by a droplet that gets on a healthcare provider's mask or gown and then drops off onto them. But also it's our main line of protecting ourselves. And so there are frontline workers, particularly nurses, some doctors too, but definitely nurses who are doing a lot of that, the bedside care, that are getting sick, and some of them are dying because they don't have adequate PPE, and it's a shame.
Yeah. Well, it's just, number one, it's just plain wrong, but also from the perspective of how we continue to treat and fight the virus, we can't possibly do it adequately if our own healthcare providers are getting sick themselves. So it's really a priority. And, from your perspective, what has it felt like to make the decision yourself to continue to do your job and to put yourself on the front line, but to feel, and I don't want to put words in your mouth, but from my perspective, to feel like the federal government is not doing its job in making sure that you have that equipment that you need?
Yeah, I think there are lots of people there are lots of kind hearts around the country who are stepping up and trying to create PPE, but you're not putting words in my mouth. I agree. I think we had an opportunity to proactively protect patients, healthcare workers on the front line, and other people in the communities. And now we're playing catch up. And to me, it's crazy. It feels like a slap in the face, honestly, that we're not being protected adequately. And that's pretty much it.
Yeah. Yeah. So, Dr. Ben, I'm wondering a little bit about testing, because this is a conversation that has been happening for months here in the US. The idea that we really lacked adequate testing from the very beginning, as we began to see this pandemic descend really on all the states in this country. And now we're having a conversation, depending on which state we're in, about where we are on the curve. And people, I think, are also trying to look forward, really wanting to know whether it's in terms of finances and our economy, or just feeling like we are really wanting to know what a return to normalcy looks like. The conversation about testing, again, becomes so, so important. And I'm wondering if you can help us understand a little bit about what testing is, what it should look like, why it matters so much, and anything else that you could share with us around testing.
Absolutely. So when we're talking about testing, most people right now are referring to something called a PCR test, which is a nasal swab that goes in the back of the nose, and it's supposed to pick up little pieces of RNA from the virus that gets sent to the lab and tell us if you have a COVID infection. One of the reasons that's really important to get that test, to have it more widespread, is that there are a lot of people with COVID that don't have any symptoms and can spread the virus to other people unknowingly. And that is a big, big problem. If we don't have enough tests, we don't know who has it, and we don't know who doesn't have it. The other thing we're starting to see right now is antibody testing. And I think a lot of people are starting to see those pop up, which are, most of them are blood tests. They're usually finger sticks, and the results come back sometimes in minutes, sometimes in days. The problem with those is we have too many companies entering the market, and the accuracy of them is very, very poor. So we don't have adequate testing to determine if someone has it, and we're not at the point yet where we have adequate testing to determine if someone has had it.
Yes. Okay, thanks for explaining that. I'm wondering if you can also help us explain, going a little deeper, from testing to the concept of contact tracing and this idea of how we continue to fight the virus, in fact, through having adequate contact tracing. I understand that, of course, must be related to testing, but do you have any thoughts on that you would want to share with us as well?
I mean, I think we need a lot more contact tracing. So contact tracing, for people who are not familiar, is essentially um, you are the epidemiologists are um, sorry epidemiologists are interviewing people who are positive for the virus, and they trace all of the contacts of that person using a number of criteria. And that way they can ideally stem the flow of an outbreak from spreading or from getting worse. So that is really, really important. I will say, I think the CDC just announced they're adding more contact tracers, and part of what I'm wondering is what took them so long. I think it's a great thing that they're doing that. They need to add a lot more, but to aggressively get things back to what we consider normal, it's going to take a lot more testing, a lot more contact tracing. Contact tracing is extremely labor intensive, and it requires interviewing a case of COVID-19 to determine who did they come in contact with, who did they live with, did they spend 15 minutes at a meeting with somebody in close proximity, because even things like sneezing and coughing and even normal speech can spread the virus if you are close enough to somebody. So it's really, really important that we have adequate testing, adequate contact tracing, and the resources for both of those.
Yeah, absolutely. Thank you so much for explaining that. And I think Dr. Shaw said maybe just yesterday, the head of the Maine CDC, that we need 2 to 3 times the amount of testing to be happening in order for us to be doing an adequate job of testing and understanding the scope of the virus and the spread of the virus here in Maine. Now, you might have seen, and maybe people who are with us tonight might have seen, that our own Senator King really raised this issue on a call, I believe, with the president and perhaps the vice president too, and called this a dereliction of duty, the fact that we did not have the testing in place that we should have. And I just want to take this moment to pause and say that there's no question that the coordination of testing, literally the tools that we need for testing around this country, and the adequate supply state by state, is something that we desperately need the federal government to coordinate. So on that note, I just have a couple more questions for you and really appreciate your time. But can you talk a little more, because I know that as the weather gets warmer and people have been following the rules and the governor's orders so well, that there's a real itch maybe to start to see other people again, or to get out, or to get back to work. And I'm hoping that you can just share with us, again, from your perspective as a doctor, what social distancing should look like, and what other precautions you think are still important for people to take.
Sure. So I prefer the term physical distancing. I heard that term on an interview, and I think that speaks more to the idea that we need to physically separate from each other, but not necessarily socially separate from each other. So that's something I've learned recently, and I'm trying to change the naming, because I think we all need to socially engage with each other much more than we normally do. This is a really important time for social engagement. So typically social distancing, the way the CDC recommends it, is at least 6 feet between you and another person. Although we don't have perfect data to suggest that's the magic number, so even a little bit longer isn't going to hurt. I've definitely seen that itch on the front lines to get back out and to see other people and have parties. So I had a woman who I talked to on telehealth, who was around 70 years old, and she was healthy, and all she had was high blood pressure, and her husband decided to host a neighborhood socially distant party and outside, which was, a nice thought. And then the weather got bad, everybody went inside, and so people weren't social distancing as much. One of the people at her party ended up testing positive for COVID a few days later. And then this patient had called me a couple weeks after that with severe symptoms. And the last I heard, she was in the ICU at one of the rural community hospitals. So these decisions to the itch to get out, I can understand the itch to get outside and be in the sun, but the itch to come close to other people, while it's well intentioned, it can be a life or death decision, and it's still really important to follow the public health guidelines.
Yeah, absolutely. Thank you for sharing what I think is really a cautionary tale for all of us. Last question for you. Is there anything that you would want me or any of us to know, or if there are people listening from our federal delegation to know about what the federal government could be doing or the state government could be doing to support medical and healthcare professionals more at this time?
I think at the federal level, no one else is going to do this be able to divvy up resources and coordinate testing and supplies and the workforce the way that the federal government could. So I think that is really important to recognize that, relying on our inventive and ingenious private sector is really important to create some of these tools. But in terms of delegating those tools out to where they're needed, it's been states and hospitals competing against each other, which as a doctor on the front line seems a little crazy and maybe a little barbaric. I think that's number one. I do think the other thing that I've seen that's still out there is that I would love testing to become free. It is not free. A lot of people think that it's free, and there are charges for people without insurance. One of the places I work is between $50 and $100 to get a test. So, Sarah, your health and my health are intimately linked with this outbreak. And so it's really important that nobody has barriers up that is going to prevent them from getting tested and prevent them from infecting other people. So I think that's number one. The other thing I would say as a physician is don't preventively take some of these medications that are being touted in the media. Definitely talk to your doctor or your healthcare provider about that before you make decisions like that. We've seen some fatal cases of people taking matters into their own hands, and it doesn't go well usually.
Yeah. Okay, Dr. Ben, thank you so much. And thank you again for the work that you are doing on the front lines of this pandemic. And special thank you to your wife, Joy, and your son as well, if they're listening.
Thank you, Sarah. Thank you so much for having me on.
Thanks. Okay, so for everybody else who is with us right now, we're just in a short transition time here as Ben departs from the screen. But we are now going to open this up to a conversation, and I would love to take questions from you. I think it is, no matter what, always important that we are communicating with each other. And as someone who is running for the United States Senate, I want to make sure that you always have the opportunity to ask me questions, even in the time of coronavirus, even as we're doing things on Zoom. So as a reminder, what Tim told us at the beginning of this is, if you have a question, if you can go down to the bottom of your screen, you will find a raise your hand button. You can click on that, and then we will get to as many questions as we can during our virtual town hall time here. It sometimes takes a couple of seconds for us to literally grab you when you raise your hand and bring you onto the screen. So I hope you will all just be patient with that mechanism as we work through it. And while we're waiting for the first person to be brought up on the screen with me, I just want to talk about some of the things that we've been trying to really elevate the conversation on around what we can be doing to fight this pandemic and also to help people come out of it and to do well. And one of those things is recognizing the frontline workers that are out there. Yesterday, we put out a call for a number of things that we think are imperative to get done. And one of those things is acknowledging the heroes among us and thinking about what hero pay for them might look like during this time. For many of us, we are working from home in a place that is safe, but so many people, whether it's people like Dr. Ben, the nurses that he talked about, or the people that we see in the grocery store and at the pharmacy, they're putting their lives and their health on the line for us every day. And I think we need to think about what their compensation looks like as well. I see that we almost have somebody else on the screen with us. It looks like Verma, but we don't see your picture yet. And I also just want to note, as you are, we're doing this from home, and I have a family here behind me and around me who is starting to make some noise, so please forgive me. Verma, are you there? So Verma, I can't see your picture and I can't hear you also. There, it looks like you're coming on now. You're connecting to audio as we speak. Okay, it's Barbara McKenna that is with us. Barbara, if you could unmute yourself, do you know how to do that? Okay.
You can't hear me, or you can?
We hear you now.
Good, I'm talking. I knew I was. Sarah, I just want to say I'm from Old Orchard Beach, and I met you in, I think it was the March meeting at for your county Democrats, and you happened to be speaking. I didn't even know you were planning to, but it was a nice meeting for me. It meant a lot for me to be there and to meet you, and you interacted with me almost immediately when I entered the room, which was very impressive for me. I'm not trying to make this very political, but it is somewhat political, let's be honest about it. I actually had a question for the doctor. So I didn't realize I was going to ask about the N95 mask. How long can you use one of those? They're reusable as far as I know. But I guess he's no longer there, right?
Well, so he may still be with us somewhere online. I'm not positive about whether he is. And so let's just give a couple of moments here to see if Tim is able to find him and pull him up to answer that question.
Okay. But in the meantime, I have a question for you.
Great.
I have probably many questions, but one specifically that comes to mind. I just want to know from your perspective, and I hope you'll be very specific. What do you actually think is your biggest challenge in the campaign against Susan Collins?
So thank you for that question.
Mm-hmm.
And I think to answer it, let me start first by just sharing with folks, because everyone might not know, that we launched this campaign last summer. It was last June when we launched the campaign. And so it's been a little over 9 months now on the campaign trail. You know, when we started this campaign, we knew what a big challenge it is to take on a 23-year incumbent and to really point out the ways in which we felt that Senator Collins was not standing up for us here in Maine and representing us in the United States Senate the way we deserve and need to be as a small state with unique challenges. And so we set out on this campaign to really talk about exactly that, to talk about the ways in which we felt left behind and that we knew so many Mainers were feeling left behind, whether it was about healthcare and the fact that Senator Collins had taken so many votes to weaken healthcare, culminating in the fact that the Affordable Care Act is now in extreme jeopardy. And the implications for us here in Maine around the Affordable Care Act going away are immense. So, you know, in the State House, where I still am, I'm the Speaker of the Maine House of Representatives. I have been for 4 years. And one of the things that we have done around this issue and others is to point out where Senator Collins and United States Congress has failed us, how under my leadership in Maine, we were left to pick up the pieces, and we did. So for example, while we still all wonder what's going to happen to the Affordable Care Act, in Maine, we passed a law and put all the core provisions of the ACA into Maine law. So no matter what happens in a courtroom or in a vote to repeal, you or I will never have to worry that an insurance company can deny us coverage because of a pre-existing condition.
Mm-hmm.
Now, the reason why I start off answering your question by talking about that is because this is exactly the place that we found that Mainers were already wondering what happened to Susan Collins. And through this campaign and the first 9 months in this campaign, we've been able to do what no challenger to Senator Collins has been able to do since she was first elected in 1996. And we actually have people in Maine saying, more people saying they're going to vote for Sara Gideon than for Susan Collins. Now, that being said, we have a long road ahead of us and a lot of hard work and a lot of uncertainty, only exacerbated by the challenges that coronavirus presents, both in terms of healthcare and the cost of healthcare and access to healthcare, also in terms of what this economy looks like and who is getting help and who will need help, and how we continue to create the economic stimulus that we need to put people back on their feet, individuals, families, small businesses. That's what we're going to remain committed to. And it will always be a challenge to be, the Speaker of the House here in Maine, challenging a 23-year United States Senator. But what we found is that people are ready for a change. They're receptive to that, and they're desperately looking for someone that they believe will stand up for them in Washington, D.C. And that's the vision that I'm presenting.
May I comment?
Well, I very briefly, and then I think we probably need to give another person.
Other person.
Yes.
Absolutely. I just hope that you can, if in fact you do win, and I hope you do, that you'll be able to bring that independent spirit to Washington. Because other than actually being independent, like our wonderful Senator Angus King, you are not. You will go there as a party person. And that seems to have been the dilemma over time. When people wind up in Washington, they seem to have to go more with the party too much at the time.
Yes.
And I'm saying that as a pretty lifelong Democrat.
Yeah.
So anyway, good luck to you.
Thank you, Barbara. And it looks like we were not able to bring Dr. Ben back up, but we'll see if we can get you an answer about that N95.
Yeah. I mean, I can Google it, I can Google it, but I just figured why he was there. But I'm glad I got to ask you the question I wanted to ask you. Thank you.
Thanks, Barbara. Take care. Thanks for being with us.
Thank you.
Okay, so a reminder to everybody on the call, please scroll to the bottom of your screen to raise your hand, and we'll bring you up as soon as we can here. I want to just briefly touch on an issue that I know many people are experiencing here in Maine, and that is access to unemployment. We did receive word today that there are, as we all know, a record number of people who have filed for unemployment, and it has been a real struggle for the Department of Labor to keep up with those numbers of people who are seeking help. It looks like by the end of this week, the outstanding issues for people that have filed and not been able to successfully start receiving, they anticipate they will be able to resolve. And we are hoping and pushing and asking every single day of the Department of Labor, when will guidance come for those people who are self-employed to be able to file for unemployment? And we know they have been waiting, received some guidance from the feds, and are trying to interface that with the Department of Labor systems, but we'll keep you updated. And I want you to know that we are also pushing on the Department of Labor for answers to those questions. We know people need help. Okay, I see we've got Matthew Sawyer on with us.
Hi.
Hi.
We met at the supper with Sarah.
Yes, we've met a couple of times, I think, at various places.
Yes.
And it's nice to see you. Do you go by Matt or Matthew?
It doesn't matter.
Okay.
Yeah, I have concerns about the election. I think that people should have the option of voting from home.
Yes. Well, Matt, I appreciate your bringing this issue up. Thank you, because I think it's a really important one. And I share the same concerns. So as a reminder for everybody who is on right now, we have election day, primary election day coming up. It's been moved to July 14th. It was June.
Yep.
So the governor has formally moved it to July 14th, and she has also said that people may vote absentee up to election day, which is
I already ordered mine.
good. I'm so glad. And on that note, let's just say to everybody on this call, you can right now request your absentee ballot. And I want to encourage people to do that. Even with the election moved to July 14th, we simply don't know what things are going to look like in terms of coronavirus and our own safety, or the safety of those people who normally work at the polls. We want to make sure that we have maximum participation and that every single person is able to exercise their vote who wants to. The best way to make sure that happens is to actually request your absentee ballot and just go ahead and vote and get it done. One thing I would love to see us to do as a state for this primary election, but also looking ahead to the general election in November, is to do whatever we can to help people get those absentee ballots. Some ideas that are floating around out there include mailing absentee ballots or absentee ballot request cards to individuals so that they can request them and make sure that they have them in hand. And I think this is something that we need to be vigilant about. And we've seen many, many governors, Republicans and Democrats in states around this country, take very, very significant steps to guarantee that everybody has access to an absentee ballot.
Yeah. What happened in Wisconsin was awful.
I agree. It was terrible. So I'm so glad you raised that issue. Thank you. And thank you for being with us tonight.
And another thing, there's been talk about the USPS.
Yes.
And what can be done to help save it?
So Matt, another really, really important point of discussion. The United States Postal Service is really in big trouble right now. And in fact, even before coronavirus, we were seeing that the United States Postal Service, was really looking for help from the United States Congress because money had been flowing sort of out of their accounts in a way that made them look like insolvency could become a problem. And now we are in a crisis situation. We have to make sure that our United States Postal Service continues to function. All of us in this country need that. And that means that the federal government needs to step in and help them. I also just want to point out one other thing when we're talking about the US Postal Service, and that is the fact that the United States Postal Service workers and letter carriers are one of those groups of people who have continued to go out and do their job every single day and who are putting their health and lives at risk at the same time. And we, number one, need to make sure that they are safe and protected, but number two, need to make sure that we are standing with them as well. So thanks for bringing that up, Matt.
Okay.
I hope I see you again soon.
Yeah, me too.
Take care of yourself. Let's see, I believe we almost had somebody else on screen, and now I see Renee Givner is with us. Hi, Renee.
Sarah, I'm just so glad that you're running for Senate, and I can't wait to see you in the Capitol. It's just going to be great. And I have a question about this. This is on the line of absentee ballots.
Yes.
When I talk to, when I talk to people on calls, a lot of them are unenrolled. or undecided, I guess, well, unenrolled, I guess you call it.
Yeah.
And so they can't vote in the primary without, registering as a Dem, I think. And so that's a problem if there's absentee ballots, like or I might have it wrong, I'm not sure, but like when, you normally will register. Do I have that right?
Oh, well, it's a little confusing. So let me see if I can explain. So if somebody is enrolled as a Democrat and they go to vote on July 14th, then they will, there are many elections that are going on. There are elections for the state house and state senate. There are, there's the US Senate, there's the congressional races. There are municipal races. There are all sorts of things on the ballot. Sometimes questions, municipal questions as well. There's a bond question, for example, for transportation and broadband. So if somebody is unenrolled in the state of Maine, they would still get a ballot that has, for example, the questions about bonding or municipal elections if they're nonpartisan. What they wouldn't see as an unenrolled is a Republican primary ballot or a Democratic primary ballot. So I hope that answers that question.
Yeah, so then my question is, like, normally when you go to the polls in person, you just sign up as a Democrat right there, as even if you can switch your registration in order to vote for you. But I think it's going to be too complicated for people that are doing absentee balloting because you have to do 2 steps.
Yes. So, Renee, you make me realize that I should have all of this in my head to be able to clearly articulate to anybody who's on the call today. But there definitely is, one can vote absentee and still decide to register with the party. I just don't have the exact process to lay out for you right now about exactly how that's done. So we'll make sure we have that information for future calls. I think that's really valuable to be able to give to people. I do want to also point out that, one of the reasons that Governor Mills decided that it was better to move the election to July 14th rather than to make it just a mail only ballot, was because she wanted to preserve same day registration for people and the ability to go to the ballot and do that. So we'll get you the remainder of that information about exactly how one can vote absentee, but also change their registration at the same time.
Thank you.
Thank you so much. Okay, so I think we have somebody named Matt Wetherell coming to join us momentarily, and there he is. Hi, Matt.
Hi, Sarah. I'm a resident doctor, actually training in Portland, Maine. I'm at the same program that Dr. Ben trained at, so excited to see he was on the call with you.
Wow.
My specific question is, one of the things that I've been a little bit dismayed as a healthcare provider and a citizen is watching something that could potentially be so unifying in terms of a response to a health crisis that's really affecting all of us turn into a more partisan and divisive political issue. And my question for you, and now that we're starting to even see that happen to an extent in Maine, my question for you is, how do you talk to people with a different set of beliefs than you, or different political beliefs than you, to help them understand the healthcare realities that, to me and other providers, take precedence over economic concerns right now?
Yes. Great question, Matt. First of all, I just want to acknowledge and thank you for your work as a resident. And I imagine it is very, very stressful for you right now. So thank you for your chosen profession and what you're doing in healthcare. this is a question that I ask myself often. And actually, I think it ties even back a little bit to Barbara's comment. Wasn't a question, but her parting comment to me, if you saw it, about the idea of going into the US Senate and maintaining the independent spirit that I think we have really represented here in Maine in the way, largely speaking, we've traditionally conducted ourselves in public policy and policymaking. And, as we saw the coronavirus really descend on us as a country, we were still in session in the State House in Maine. In fact, we still had about 5 weeks worth of work in front of us. And in the span of about 4 days, it was this, and I'm sure everybody experienced this in their own profession and lives, but it was this quickly dawning realization that we were dealing with something that was absolutely going to be like a tidal wave upon us, and that we had to change our entire trajectory, both in terms of literally closing down a building that drew hundreds of people from everywhere in the state in a way that felt deeply irresponsible to continue doing for the sake of health and spread of the virus, but also that we needed to think about what needed to be done proactively to put protections and money and any changes into law to allow us to deal with the pandemic. And I'll tell you that, I've worked in state government for these 8 years, and some of those years were really challenging years with closely divided government and a governor who didn't really want us to get along. We had to figure out how to get along every day, and ultimately we did, but it was challenging. But what I saw in these days when we sought to close and adjourn the legislature and to pass these omnibus bills and appropriations was the kind of coming together that you're talking about, and that it is really all about, where we looked and we said, here's what we think is going to happen in education. Here's what we are afraid is going to happen in the healthcare realm. Here's what we anticipate could be upon people in terms of unemployment. And how do we just make it come together? And we literally just had conversations about it and got it done. And I had this real sense of this is exactly what it is supposed to look like for us to work together and to think about the goals that we have for each other as human beings. The crisis brought us together and allowed us to do that. Now, I think as we have seen probably every state by state versus the federal government, it has been much, much more difficult for the United States Congress to do that. And, we saw both with the third and the fourth package, some real disagreement and negotiating before finally settling on a package. I think that is unfortunate. And I think that it makes me very worried about what the responses that are needed from the federal government going ahead are going to look like. We already see a little bit of a standoff between Mitch McConnell and Chuck Schumer about the next package and the timing of it. But I hope and I believe that ultimately the needs of us, both in terms of our healthcare and in terms of the financial devastation that I think too many people are seeing in Maine and across the country, will prevail in helping them continue to come together. And I think the only other thing that I want to say on this point is, I had to ask myself the very tough question when I decided whether or not I was going to run this race, of whether I thought I would be good for this job, whether I thought I could be a good United States Senator. And that's a big question. And it took me months to answer for myself. But part of how I answered that question was by looking backwards at my experiences in the State House in what were undoubtedly the most challenging and divisive times in state government. And the fact that I had to rise to that challenge as a legislative leader and learn as I went and take leaps of faith in other people to bring us together, but that ultimately we were able to do that. And when we got over that hump and came to a new world after the 2018 election, where suddenly Democrats, my party, was in charge of everything, my decision at that point was not to just proceed with a nice big majority, but to think about how I could bring us back together and heal some of those real hurt feelings and distrust that had grown. And that's why, as you might have seen, I decided to get rid of the proverbial aisle and mix our seating, Democrats and Republicans sitting next to each other all through the chamber. And I actually need to go look and see what our latest statistic was, but at some point during this session, nearly 75% of the bills that had flowed through the State House were unanimous reports in committees because of that work and bringing people together. So that's the kind of leadership you can expect from me in the United States Senate. It's not easy, but it was always what I will push myself to do.
Thank you very much for that answer. I think similarly to you, to some extent, I've been really encouraged by what I've seen locally and statewide. I've seen the city of Portland figure out how to take care of the most vulnerable patients and the most vulnerable groups, such as the elderly and the homeless and immigrant groups, and people who are newly unemployed. And I've seen a similar thoughtfulness at the state level. So I'm just really eager for that to be a national conversation and a national coming together. I'm really thankful that you allowed me to speak tonight, and just wanted to wish you luck with your campaign. Thank you very much.
Thank you so much also. Thanks for being a part of this tonight, and thanks for your work. Safe and well.
Thanks.
Thanks.
All right, everyone, we have time for just a couple more questions here, so I'll promote our next question asker to On Screen with Sara.
Okay, so while we're waiting for the next person to raise their hand and come on the screen, I just want to mention the incredible people that I get to work with every day on this campaign, one of whom is Tim, who's talking to us tonight, but Tim is our operations director on the staff, and he, along with all of our staff, have taken this opportunity when we are not conducting business as usual to go out in their communities and to make sure that we are taking care of people. They are out donating blood. They have been delivering groceries, checking on neighbors, and doing so much. And so I just wanted to give a special shout out to these amazing people I get to work with. I see that we have Jonathan Goebel, who has joined us, and it's nice to see you. How are you doing?
Oh, I'm doing fine, Sara. It's nice to see you.
Nice to see you.
I wanted to ask you about rural health care, that so often discussions of access to health care focus on paying for it.
Mm-hmm.
And of course, here I live in Cherryfield in Washington County. And the real question very often is, where do I go to get health care?
Mm-hmm.
We've got 2 hospitals, both of them in financial difficulties.
Yes.
And this is a national problem in rural areas. So what do you see that you might be able to do in the Senate to address these problems?
Yeah. So thank you very much for that question. And we touched on this very briefly in the beginning. Jonathan, I don't know if you had tuned in yet at that point, but one of the things I mentioned was the challenges that we do have in rural areas
Mm-hmm.
with access, and the fact that the places where we still have rural healthcare centers and hospitals, the strain that those hospitals particularly are under are immense, even in a non-COVID-19 or coronavirus time. I know that there are many of our rural hospitals that operated on margins of basically 2 weeks, in reserve. And now we know that Calais is real trouble here, Calais Regional Hospital, and Down East, I think, is doing better and trying to think about how they might be able to help Calais Hospital. But, I was just having a conversation the other day with someone from one of these hospitals about what could be done on the federal level. Certainly on the state level, how we think about reimbursement rates and how we think about helping physicians and nurses make the decision to live and stay in Maine and work at those hospitals is very, very important. but we also have to think about rules and regulations that exist that might, for example, have special, we might have special rules for those rural hospitals or healthcare centers that are deemed critical care, but not for others. And they could really use some of those same programs that exist in order to help their economy and flow of money to be able to recruit doctors and nurses and to literally keep the lights on and functioning. So I think those are some of the things that we need to do. I think it's absolutely vitally important that we do already in rural Maine. We know that there are people who have to drive hours, round trip in order to see a doctor, or to drive all the way to a different part of the state in order to see a certain specialist. And that's just not okay. We will not continue to have life in rural areas if that is the case. It's like the proverbial death spiral.
Exactly. And unfortunately, sometimes literally when people don't get the health care that they need.
Yes, that's right. That is the result. People don't get the health care they need in time. They get sicker, and outcomes occur that shouldn't have and wouldn't have otherwise. If we continue to let our rural healthcare systems fail, then we will have less and less people. This is what we already see in Washington County, where you live, in Aroostook County and Piscataquis County. Less and less people are able to live there for that reason. And then we continue to see the healthcare go away. We can't allow that to happen.
I thank you.
Thank you also. Really appreciate it.
Good luck to you.
Thank you very much. So it looks like we have another person coming on the line with us now. And I see her. Hi, Lori. How are you? Oh, Lori, I can't hear you. It looks like you might be muted.
On my end, it looks like I'm...
Now I can hear you.
Okay.
Yeah, thank you.
Thank you, Sarah. Thank you for doing this. I met you back in 2016 at Tim Cheney's farm when we did the Rockers in Recovery big event, and you were there as one of the speakers on Friday night. So it's been quite a while. My specialty is as an addictions counselor. And that's what we were all there to be talking about. And I really appreciate all the work that you've done on a state level. Even with the past administration to get help for our folks. I'm also in recovery as well. My question tonight is, when you are elected to the U.S. Senate, what will you do to help enforce and strengthen the Mental Health Parity and Addiction Equity Act with insurers so that people in the country have the coverage that they need for comprehensive mental health and substance use disorder treatment? Most insurers apply these payments now for this treatment towards exorbitantly high deductibles. I've seen it on my own end when I go to get help. I have good insurance through Anthem right now, but to see a mental health therapist, I have to pay out of pocket towards an exorbitant deductible. I've seen it as a clinician, in that I've had clients who we put in there, they come and they see me 3 or 4 times, and it takes Anthem, a month to get back to me about whether they, have a deductible or not, whether that's going to go towards their deductible. And then they can't afford to pay me, so they have to stop seeing me, and I don't get paid for the time that they've been there because it's not covered. And we should be doing something where at least, it's okay to have to do a $20 copay or something like that. And I could understand that. But right now, people can't, it looks like they're covered, and the Anthems and the other insurance companies will say you're covered for mental health and substance use disorder treatment, but they're really not.
Yes. So, Lori, first of all, it's nice to see you again. And thank you for the work that you do, and for coming on and being with us tonight, and for raising this issue. And I want to start by saying that absolutely making sure that everybody has access to mental health, behavioral health, and substance use disorder treatment is an absolute priority for me, and it needs to be for every single one of us. Now, whether it is by passing bills that are already in Congress and being considered either in the House or the Senate, or whether it is introducing new legislation that brings parity for coverage of for patients and payment to for providers for mental and behavioral health, I think it is an absolute necessity. And we are fooling ourselves if we think that healthcare is just about that physical health as well. So this is a priority for me, and it will continue to be a priority for me. And I think that whether we're talking about substance use disorder and short-term recovery or long-term recovery, or whether it is just about access to that healthcare overall for people absence of substance use disorder, that we have to be on top of this. And, unfortunately, I think that coming out of this pandemic and all of the other things that are caused by this pandemic, we are going to see that need only increased, and we have got to be reacting to it and positively making that care available for everybody who needs it.
And while we're at it, we are one of the least paid per our educational time frame. Most folks in my industry have to have a master's degree and several licenses in order, and lots of continuing education, and we don't get paid very well, just like teachers and some of the other folks that are out there. So anything that you can do to keep that in mind as well. The insurers seem to wiggle out of these things. The Parity Act was passed like in 1997 or something like that, and so it in its essence, it's been meant to be followed, but it hasn't been, and they've found lots of ways to wiggle out of it. So strengthening those laws and looking at new ways to state them would be one thing that I would be hoping for.
Yes. Lori, thank you so much. I really, really appreciate your bringing this subject forward, but also your ideas for how to solve this. And I look forward to seeing you again in person one day.
And I'll be volunteering for your campaign too. So
thank you so much.
Take care.
You too.
All right, that was the last question that we had time for. So thank you to everybody who's participated tonight. And I will hand things back over to you, Sarah.
Thank you very much, Tim, for keeping us moving here on Zoom. And thank you to each and every one of you for being a part of this virtual town hall with us. I do want to say that I desperately miss seeing all of you in person, and I cannot wait for the time that we're able to literally physically be together again. And I wish that in this campaign, we were still traveling around every part of the state, meeting people, but we're going to do everything that we can to continue to have forums like this, to keep them interesting by having guests who can help us all understand the specific challenges that some of us in Maine are facing, or the ways and opportunities that we can overcome those challenges and meet them. I want you to know that I am running to be our next United States Senator because I believe in us, and because I believe that we need somebody to be standing up for us. There has never been a time where it is more apparent that we need new leadership in the United States Senate, whether it is because every single one of us should have access to healthcare that we can afford, whether it is because this pandemic is an example of something that we could have been prepared for knowing it was coming, whether it's because here in Maine, we, speaking of Earth Day, already see and feel the effects of climate change on us, on our livelihoods, and that we now have the ability to be prepared for that in the same way that we could have been for this pandemic. These and more are the reasons that I want to become our next United States Senator. And my promise to you is that through this coronavirus time, I will continue to be here for you all. My reminder to all of us is that we are in this together, and I can't wait to see you on the other side. Thank you so much.